Well, the answer to that is no. And the reason is because if you look at patients with COVID, there are three possible groups. Firstly, the ones with obvious symptoms. Secondly, the ones who are pre-symptomatic, which means that they haven't got any symptoms at this point in time, but they will develop symptoms in a few days' time. And lastly, the third group is the asymptomatics. So we now are beginning to understand more about this disease process with COVID, and we also are beginning to appreciate that a small percentage of patients with COVID do not present with any symptoms whatsoever. But these patients may still be infectious. It is not necessarily true. So you may have seen in news reports and even various medical reports that patients with COVID frequently complain of the loss of the sense of smell or taste. So yes, it can present in that way, but equally we see a large number of patients who do not complain of these symptoms at all. And the additional point is that COVID-19 is a respiratory tract infection, and other similar respiratory tract infections like the common cold or even influenza sometimes can dull your sense of smell, so it's not specific for COVID. That is true if you live alone in the middle of nowhere. But I think for most of us living in Singapore, that is not possible. So because of that, I think wearing a mask is very important for two reasons. So firstly, if you have upper respiratory tract symptoms, the mask, when you cough, will hopefully catch most of the respiratory droplets that you produce. And also the mask, when someone chooses to be unhygienic and coughs at you, at least the mask is there to try and catch some of these secretions. So it's very important that even if you think that you are socially distancing from somebody else, that you need to keep your mask on. Older people in society are just as likely to catch COVID as someone young. You would think that if someone were older and have other medical conditions, that perhaps their immune system may not be as strong. And because of that, their risk theoretically may be higher for catching COVID. And if they do catch it, it may be more severe.